Well, very soon we will have a new president, and he will be working with a Republican-controlled Congress, and Congressman Robert Pittenger joins us right now to talk about that and some other issues. Thanks very much for joining us. Happy holidays, by the way.
Sure, Rob. Good to see you.
Do you think you will be able to, or Republican-controlled Congress will be able to work well with President-elect Donald Trump?
I do. I think our interests are joined. When he came and met with us last July, he presented his interest and concerns, and frankly what he ended up doing was embracing our reforms. He's not a man who's in the weeds with details, and when he began to understand what our reforms were relative to Medicare, Medicaid reform, and all the health care reform, tax reform, all the issues, he embraced us in our reforms. So I think we're probably 90% in concurrence on what needs to be done.
Is the Affordable Care Act or the repeal of that #1 on at least the House's list?
Sure, I think there's one or two. I mean, they're all up there. Health care reform, tax reform are both critical for us, and we want to address both those in the first 100 days.
It's no secret that the Affordable Care Act has proven popular, at least some portions of it have proven popular with both Democrats and Republicans. Many more people are now insured because of it, tens of millions. What happens with that? I know that you've been here before, you've talked about replacing it with something, but there's really nothing on the table right now. Would it be better to come up with a plan first before repealing the Affordable Care Act, or are you just willing to go ahead with a repeal?
Well, we do have plans, but frankly, the plan itself right now, all you have to do is look at the premiums. They're skyrocketing. Look at the deductibles. They're going way up.
Yeah, but you know as well as I do that most people that are on the Affordable Care Act are being given help, so their premiums aren't really going up that much.
65% of American people want to do away with Obamacare. They want that reform, and we're going to respond to that. We're going to have a market-driven reform where it'll be open up. You can cross state lines to be able to sell it. Competition is what drives prices down.
So why not come up with that first before repeal?
We have it. I'm a co-sponsor of one of those bills. Dr. Price, who's the person to be selected by, is selected by President-elect Trump to be the head of HHS. I'm a co-sponsor of his bill. And it's a very market-driven bill. It's what we need.
Okay, I don't want to center just on that, and we're going to have more to talk about in a second part of this interview, but do you think a Muslim registry is needed?
I don't know if it's a Muslim registry. I think I appreciate the concern relative toward individuals and coming out of countries that clearly are very unstable, that have been a source of Islamic terrorism and sponsors of it. So I think we need to be looking specifically with Syria and Iran and Iraq and these countries that have really been on the forefront of Islamic terrorism.
As I said, we have more to talk about. We'll continue the conversation tomorrow. For now, Representative Pittenger, it's always great seeing you. Thanks for joining us.
Good to see you.
That's our end of conversation for today.